Why do we get pigmentation of the nails? Is it something to worry? How can we identify the early signs of melanoma or the cancerous growth? I am Dr. Vasavi from Vasavi Skin Center, Tanisandra, Bangalore. Pigmentation of the nails is one of the common conditions faced by most of us. This pigmentation can happen like linear lines, or it could be horizontal, or sometimes it can be diffuse. Both fingernails and toenails can be affected. It can involve one or two nails, or sometimes most of the nails can be involved. How does this pigment form? Similar to the melanocytes present in the skin, we do have melanocytes in the nail. These melanocytes are present in the nail matrix, which is there just beneath the nail fold. And from here, activation of the melanocytes will lead to production of more melanin, which is being transferred to the nail plate. Sometimes increase in the number of melanocytes can also lead to pigmentation of the nail. This is seen in nevus or the birthmark, certain lentigens, and also melanoma or the cancerous growth. What are the common causes of pigmentation of the nail? Most common cause is the racial or the genetic predisposition, seen commonly in the dark skinned people like Africans and Asians. Here the pigmentation is seen like linear lines, commonly on the thumb and index finger. As the age increases, width of the lines will increase. The second common cause is the trauma. The trauma can be a single huge trauma, or chronic minor trauma can lead to accumulation of blood underneath the nail plate and pigmentation of the nails. Wearing ill-fitting shoes or the narrow shoes will lead to friction of the nail plate and lead to pigmentation of the nails. Some people do have this habit of biting the nails or picking the skin from the proximal nail fold, or sometimes pressing the nails. This will lead to pigmentation of the nails. In pregnancy also, there can be activation of the melanocytes, which can resolve after delivery, or sometimes it can persist. Nutritional deficiencies like malnutrition and vitamin B12 deficiency can lead to pigmentation. Certain endocrinal or the hormonal issues like hyperthyroidism, Cushing's syndrome, and Addison's disease can lead to this. And the drugs which are being given in chemotherapy can also lead to pigmentation. Certain infections like nail fungal infection or the bacterial infections of the nail, or in HIV also, we can see pigmentation of the nails. How to identify the early signs of melanoma? Melanoma is commonly seen in elderly people, and there is genetic predisposition. The bands of pigment will appear rapidly, and there is a change in the color of the pigment, and the borders of the pigment will be irregular. And the pigment will be extending onto the skin fold. So whenever you see these signs, you have to consult your dermatologist. So if it is being identified early, then the diagnosis can be made with nail biopsy, and the treatment is excision of that nail.